Hi, I'm Dr. Rich. I'm teaching you about dentistry and teeth so you can have a very nice smile. Thanks for joining me today. So this tooth, I diagnosed with a crack on the back side of it a couple years ago. There you can see the crack extending from the back side, the distal side of the tooth, out to way past the middle. And as you can see too, it's a lower third molar. And there you can see that the crack is going down the root. It's got a little bit deeper pocket. Now this tooth is a bit unusual for a third molar because as you can see on the x-ray, tooth is fully erupted and there's room. There's even room behind it. So this tooth was fully up, easy for the person to clean, and they were using it. They were chewing with it. They were a clencher and a grinder as well. And I think that's what caused them to really crack the tooth. One thing that I am a little concerned with though is the shape of the roots. You can see how the two roots are fairly hooked towards each other. So in those situations, when I see that on the x-ray, I always let the person know that there's a chance I'm going to have to section the tooth, basically cut it in half with a dental handpiece to be able to remove it. So the first thing I like to do before extracting the tooth is I just take my spoon excavator and I work it all the way around the tooth. This does two things. One, I'm checking to make sure that the person's numb. They'll feel pushing and pressure. They shouldn't feel any pain. Secondly, I'm separating the gum from the tooth. And it's kind of cool. You can see the blood kind of following the line of the crack there. I'll also, when I'm extracting a lower tooth, use a bite block so the person can bite down on it, stabilize their jaw more. Next up, I will take my spade proximator. I use one made by Carl Schumacher, and I work that around the tooth. Just basically get it in between the tooth and the jawbone down in the PDL space. And if you look close, you can actually see it moving a little bit. And I just need to keep working it and working it as much as I can. The looser I get the tooth will become, and the easier it will be to remove. Clean up some blood so I can get a better view. But now if you look close too, that crack's going all the way across there from the back side to the front. That crack was there the whole time, it just wasn't very visible. And now back to the spade proximator, and basically I'm just trying to get the tooth to move. So I'll keep doing that. Now I switched over to the 301 elevator. This has got a thicker tip than the spade proximator, and again I'm just putting it back into the same space that I've created with the spade proximator. I've got to take a little break because the patient felt that a little bit, so I'm going to give him some more anesthetic. I'm using Septicane here, so I'm just giving him a lower mandibular block, again, just to get him numb, and a little bit on the buccal side of the tooth. That's going to help with the bleeding. All right, patient says he feels number. Let's get that bite block back in place, clean up some of the blood with the surgical suction, and again back to the 301, and now you can really see it moving. So we'll try to wiggle it, and the key with before I put forceps on it is try to get the tooth to move as much as possible so that when I go to remove it with the forceps, here I'm going to use a pair of cow horns, see if I can get those down into the furcation, where that spot where the two teeth meet. But I'm struggling with them. I can't get it. I think the furcation's too far under the gum, and I can't get them. There's no depression on the tooth where I can get the tips of the cow horn forceps to bite, but I can move the tooth with it. But I can't get a good grip on it, so I'm just gonna try a couple more times, but I'm gonna have to switch over to my favorite forceps. Again, another cleanup, but now I'm using my apical retention forceps. This pair is made by Carl Schumacher. It's probably my favorite pair of forceps that I use. The beaks of it are very thin. I can get down underneath the gum line, and I can get a good solid grip on the tooth to help remove it. And now I just move it back and forth towards the tongue, towards the cheek, wiggle it back and forth, a little figure 8 motion too, a little rotation to get it to come out. Those roots had pretty big hooks on them. I'm trying to get them out in one piece, so hopefully I won't have to go digging for them, do any surgery to remove them. And the tooth really wants to come out. It's getting very loose. It's almost there. And you don't want to force it. You don't want to muscle it too much at this point. Just a little bit. There you can see it coming out. It wants to go. You actually take the tooth the direction it wants to go. And this tooth wants to go towards the cheek side. And there it is. But uh-oh, what's wrong with that picture? We lost the back part of the root. Can you see it way down in the socket? It's right down there. There it is. Let me circle that for you so you can see it better. but that was what I was worried about. But fortunately, that I was elevating it so much that it's loose and it's not in there very securely. It's just a matter of fishing it out. So first, let me attempt to get in there with the spade proximator. I think the tip on that spade is just a little bit too thick to get down into that root space. I mean, worst case, I'm trying to tease it out without having to resort to using the handpiece. Worst case, I can just remove the bone in front of it. That's the bone that's in between the two roots, and that to get it out. But now I'm just using a distal angled, thin-tipped proximator. So this instrument is designed to go down the backside of the socket and get in between the root and the bone there, and it's moving the tip around. I got it moving back and forth, and it's fighting me, and I got it moving up and down. And there, I just shoved it back into place. So just got to find the proper angle to get it at, and a little bit of torque on there, a little bit of pressure. Basically, you're trying to put the proximator down into the spot where the root tip is, and now I switched over to the mesial to get it from the other angle, and there it goes, using the suction to help hold it. And there's the piece. So now once I get the piece out, important thing to check is to make sure that you got the entire tooth. So all right, here's the bloody tooth. Haven't had a chance to clean it up, and there's the root tip. And it looks like we got it all. The mesial root, the other root's all in one piece, and there's that big chunk. So when you have a tooth, when you sign a consent form to get a tooth removed, the dentist always points out, well, if a small piece of the root tip will break off, we can just leave it there. That was a little bit too big. Patient's clotting already. Let me have him bite down on some gauze. But that piece is too big to leave. I wouldn't have felt right leaving that. And since it was pretty loose anyway, even if you had left it, most likely would have come out on its own. And there you can see the whole tooth and nothing but the bloody tooth. Now I'm just cleaning the person up. My go-to joke is to say, hey, I don't want people to think I beat you up real bad. So next, I soak the tooth in some bleach to clean it up. And there you can see the crack on the biting surface of the tooth, and that's where it goes down on the back edge. And that's right where I was using my periodontal probe following that. The jawbone was actually pulling away from that crack. And there's the piece that snapped off it. Let me try to reposition it so you guys can take a closer look at it and see what the geometry was that we were dealing with and why it's cracked off. So as you can see, it's hooked, but it's also not just towards each other, but that back was hooked towards to one side, and that's what kept it from coming out in one piece. I hope you guys found this interesting. It's always fun doing these types of videos. I know these are a little bloody too, and YouTube doesn't like to show them. Any questions or comments, please leave them down below. Please give me a thumbs up if you like these sort of videos too, and consider subscribing to my channel. In addition to these types of videos, I also have lots of just regular non-bloody dental content. All right, thanks so much. See you in the next one.